Hi, I'm Karan Kapoor, and I'm an ENT head neck surgeon based in Surrey. It's because I like people. So it's all well and good liking science, but I couldn't be stuck in a lab. I like talking to people, like spending time with them. So this seemed like the best merger between those two competing desires in my life. I remember being in theatre with one of my consultants when I was a junior doctor, and he had opened the neck. And I remember learning about it at medical school, and it seemed so complex, and there were so many things going up and down and left and right. And when we opened the neck and we could see all those different structures and how that they interacted, and then being able to operate on them and to improve somebody's function outcome, it appealed to what I like, things which are complex, but also getting people a good result. Well, I was born in Manchester, and it was quite cold. So my mum said to us, "We're going to have to move to Southampton." So I grew up in Southampton, and hence why my children have gone to watch the Saints more times than any other football team. I deal with newborn children all the way up to people who are there in their 90s. So you've got to really throughout their life. And also, there are lots of different nuances to my job. You've got the throat, you've got the nose, the ear, and they're all their own challenge. So that I feel that I'm always being challenged, and I'm meeting lots of different people and helping them at different stages through their life. I think my patients value most about me honesty, and I don't have a stiff upper lip, three-piece suit approach. I talk to them like they're a person. I try to explain to them things the way that I understand them. And I also try and treat them the same way that I would want one of my friends or family to be treated. I've sat at the other side of a doctor's desk with family members and often thought to myself, you're not explaining it to them, you're explaining it in a purely medical way. And that can be intimidating. So hopefully what people value about me and I value about my patients is really good communication, clear things, and taking time and respecting the fact that they can be worried, scared, and no problem is too simple because it's the first time they've had it. We've got distinctly different areas to work on: the nose, the throat, the ear. And how do I deal with that specialization? Is that I know what I'm really good at, and I work with a team of people. And when I know one of my colleagues is more skilled in a certain area, I will quite happily give them a ring and make sure my patients not only get the best of my knowledge, but get the right person for the right problem. I think when things are challenging, I become more calm. And that's a really odd thing to say, but my colleagues have sort of mentioned this, that when things are, as they say, hitting the fan, I seem to come into my own even more. I think the reason is because you feel well trained, you've seen it many times before, and you realize that you can trust your skills and actually not worrying about it, but actually just focusing on the bits you can change, are what sort of keeps me in check. So I'm very, very fortunate that I work with a great team, and we don't have difficult situations that often, but when they are there, we work together, we communicate clearly, and we've built good relationships to not get frustrated.